Hello, everyone. Welcome to our Diva and Bubbly event. We've got our bubbly here too. Cheers.
Cheers.
We're so excited to be able to put on this presentation for you today. My name is Amanda. I'm the practice administrator here at Alta Vista Dermatology, and I have the honor sitting with our owner and medical director, as well as board certified dermatologist, Dr. Szabo. She is an expert in the procedure we'll be discussing today, and so she's going to discuss Diva, and we will also have a patient staff member as well, testimonial, and we're happy to answer questions that you have. We will probably get to most of them at the end of our presentation, but feel free to ask. And without further ado, take it away.
Thank you. We've been waiting for this event for so long, so thank you for joining us. We are so happy that you're here. And make sure you send your questions. I would love to answer all of them because this is an important topic, and a lot of times people are afraid to ask questions. So this is a perfect opportunity for you to cover all of that information. So without further ado, I'm going to put down my bubbly, but you can sip on it, but I'm going to probably talk, and I don't want to spill it in the midst of my articulations here. But welcome to our event. We are so happy that you're here. I want to cover today something that is actually a taboo in in most social circles. This is something that people don't talk about, but it is a big problem. They the assessment is kind of varies, but 10 years ago in the United States, they estimated 53 million women having this female feminine health problems. And that is a problem that affecting millions here in this country, but of course it affects all across the globe. We also know this from the fact that when we look at Google search, there are certain buzzwords that are being searched steadily over the past couple of decades that is indicating that this is an issue for many, many women who are suffering from this on a daily basis. These buzzwords, for example, feminine rejuvenation, female vaginal dryness, surgery in the vaginal area. So these are words that we know for sure that women at home, while nobody is looking, searching, because this is something that's bothersome and they have to live with this on a daily basis. So what causes this problem and who is affected by this? We know that just general body changes in our bodies over the years, over the decades, will cause certain changes in the genital area, but certain things will accelerate these changes. So that would be, for example, vaginal childbirth, or menopause or early menopause. So menopause is, of course, a biological thing that happens to all of us. Sometimes genetically it happens earlier in the 30s. Nowadays we know that sometimes it starts as early as in the 30s. But of course, most common 45 to 50-year-old women when they go through hormonal changes. Of course, this can go through much faster too if someone goes through chemotherapy, for example, or hysterectomy for medical reasons. So all of these processes basically lead to changes in the genital area. The changes kind of can go in different levels, but and can be gradual, but sometimes it is actually just immediate, for example, right after a hysterectomy. So the changes kind of start with a drop of estrogen level in our body that will lead to thinning of the vaginal wall, decrease of the glands that will produce the lubrication of the vaginal wall, and then as the vaginal wall thinning actually will stop supporting the surrounding tissue, and therefore bladder leakage can happen, then laxity of the vaginal wall, and the dryness leads to an environment that can actually cause recurring infections. So these are, of course, difficult topics for everyone to talk about. So let's see, the symptoms that sometimes we hear is, urinary leakage with sneezing, coughing, running, and this is actually a very common problem. Now, we also hear about the dryness that causes itch sensation in the genital area that also consequently can lead to recurring infections. So these are all symptoms that, some people have more than one side than the other, but ultimately all of these are signs of changes in the genital environment in the vaginal area. So what we know that occasionally women will reveal these symptoms, but a lot of times for many, many years, they do live with these disturbing complaints. So, when we assess people, a lot of times we have to look at the whole person and see where they are at. So we often collaborate with OBGYN specialists just to make sure that the hormonal levels are corrected. But at the same time, how we're going to restore this genital area is the question. Because interestingly, when we replace estrogen and progesterone hormone levels, automatically this is not going to get fixed. So something needs to be done. In the past, there was only available surgical corrections, which are major general surgeries in the operating room under general anesthesia with lots of complications. The good news is that when nowadays we address this early on, we can actually do so many things before we get to the surgical correction. And some people, because they start the correction early enough, they probably will not need those major surgical procedures. So the past 5 to 10 years, actually, there have been many technologies that companies have been trying to work on, since this is such a major problem and affecting so many women. So in the evolution of different technologies, actually several laser companies developed different laser devices or radio frequency devices. These are the two technologies that are available. But to actually, in our search to help women, basically we found that this laser that we're going to talk about tonight is the most effective treatment for vaginal health and correction of the vaginal anatomy. So Diva, that we are talking about, it is named Diva, which is a very catchy name. I love it. But beyond that, this is catchy. This actually is an amazing technology. A lot of people don't realize that it is a dual laser. So actually it has two different laser wavelengths working simultaneously during the procedure that will actually help in the correction of the vaginal anatomy. Because there are two levels of the anatomy that we want to help. Therefore, we want to affect both at the same time. Therefore, the company decided that put both lasers at the same time to fire it. So therefore, at the same time, we can correct the superficial and the deeper layers of the vaginal wall. So erbium is one laser and diode is the second laser. Erbium laser is going to affect the superficial part of the mucosal surface. This actually only with every treatment only affects between 10 to 20% of the vaginal wall. So it is not going to eliminate the entire surface, which would be very painful and would not be recommended. We, in fact, use similar laser to resurface, for example, the facial skin. And even there, we only use about 10 to 20%. So therefore, the recovery is faster and very minimal. That assures very minimal downtime. So erbium laser will eliminate about between 10 to 20% of the superficial vaginal wall. But it is such small percent that it is not going to feel painful, or it's not going to have significant after treatment side effects. By removing these abnormal cells, actually this is a stimulus for the body to create new and fresh skin cells that will replace the old one that are not functioning the way they should be. So we know that this is an observation that long-time researchers noticed, that when you actually remove partially the skin, that is actually the body is realizing that it will need to repair that area, and you will repair it with fresh new cells. So that is what is going to happen when we use the erbium laser. It actually will repair and replace those missing cells. So that's what the erbium laser does. It removes the surface, partially the surface cells, and these new cells will grow in, including all the cells that actually, they're called glycogen cells, that actually provide the lubricant in our genital area that is essential to restore the original environment. The second laser is the diode laser that will affect the deeper part of the tissue, and it actually will go all the way where it will stimulate cells, something we call fibroblasts. These are the cells that will actually make new collagen and elastin. So it will restore the elasticity of the vaginal wall, and therefore eliminate pain. That women can feel with all these changes. It also will help to thicken the vaginal wall, which is very important because it will then support the bladder and the urethra, and therefore the leakage will actually stop. So this is maybe more than what you wanted to know about the anatomy and all the mechanism of action, how this laser works. But I think it's good to know that there is actually a lot of supporting evidence how this works, and this is not something just speculative, but there's a lot of research behind this. So that said, let's talk a little bit more about how in reality, how this actually works. So just briefly, I'm going to talk about it, and then our wonderful Adrienne here, she will actually reveal a little bit more to you all. But basically, it is a very quick treatment. We apply numbing gel for about 20 to 30 minutes to numb the whole entire area, and then the treatment on its own is about 3 to 5 minutes, really not very long. We customize the treatment based on the damage that we see, the anatomy and the tolerance. If someone is more sensitive, we can adjust the settings just to make it really more tolerable and still very helpful. So the treatment is basically pretty fast. After the treatment, you can drive yourself home. There's no need for a driver to come to the office with you, and you can resume your normal daily activities. You can resume your work. You can resume your sports. Basically, for 2 days, you can have very minimal cramping or a little bit of spotting, but it is very minimal. And we have actually lots of clients who actually only had for 1 day very minimal spotting. So it's really not significant. In sexual intercourse can resume in 2 days. So it's actually, we have not seen side effects from this treatment. It is very safe, very minimal spotting or cramping, but that's about it. So, I mean, it is hard to name another procedure that would be so safe and so simple and would have such an impact in someone's life on a daily basis. So I think that that's kind of in a nutshell what I can tell about this treatment. I am very passionate about this just because I on my own have 4 children, and I do know about these symptoms, and I just think that it makes a huge impact in women's lives. Something that nobody likes to talk about. Even best friends will not reveal, and something that we can make a huge difference in someone's life.
So I think it's important to note that it is something that most of us are uncomfortable talking about, but we're here to tell you that it's not. Most of us, if you've been to our practice, have had children before. And so one of our staff members has also had children, and she's had the procedure as well. So we're going to introduce Adrienne, and she'll go over a little bit of her experience. So come on over.
Hi, everyone. So just want me to talk about the procedure?
Yeah.
So truthfully, my experience was great with the procedure. It was super quick. I didn't experience any spotting. I actually had no cramping afterwards. It was super quick. When I, intercourse after when I did was like not painful at all. I did help with like dryness. I do have 4 kids that I had vaginal deliveries with, all of them, and they were all huge, being 9 pounds 5 ounces. So I did have a big fear of like the bladder dropping, just because I know those procedures are pretty intense. So I didn't have any like too many symptoms before I did it, but when I was offered the procedure, I was like, okay, I have 4 kids. I definitely need this for future like health benefits. And it was great. I mean, truthfully, I have no complaints about it. It was like super minimal discomfort. Felt kind of like a knocking in the vaginal wall, but no pain whatsoever. And yeah, afterwards, it was like nothing really happened. Like it was actually better than a pap smear from what I remember it. Like, so, I mean, super good experience. Overall, I had no complaints whatsoever, and I would do it again multiple times.
That's so good to hear. I feel like that's a very general feedback what we get. We wanted her to tell you on her own, just because it's good to hear from someone. And I can tell you that I have had this treatment too, and very similar experience. I just think that no matter what, this is just the law of physiology, that as we go through changes in life, our body will change. However, who's to say that we need to be living with these symptoms when actually technology is available to help us? So it is simple, and it is even if there is somewhat of a discomfort during the treatment, because some people may have that. It is really, people do come back, because we do recommend, and this is what the company also recommends who developed the technology, is 3 treatments about a month apart. And people do come back for the second and the third, and as we do these treatments, the changes and the improvements will be significant every time. There is an immediate change, and then there is a delayed change. So something that, it will continue to change. And that is also a very good explanation for that, because the diode laser, as I was explaining it, actually stimulates collagen. That is not immediate. So that change will kick in within 4 to 6 weeks. And so those sort of changes will continue to improve 2 months into, after the treatment. But so with that said, so the 3 is the ideal treatment. Now I have had someone who actually even wanted to do a 4th one, just because her changes were so significant and she loved the improvement. And we do recommend possibly every year or every other year maintenance, just so that to maintain, because as we go through, as days go by, that collagen will continue to break down. So to actually maintain, it's something that we find beneficial. Adrian, thank you so much. It's not easy to
not.
publicly talk about this. I know, I totally know this, but at the same time, though, just to me, it's so important to impact people's lives, and you are impacting people when they listen and they know that it, it is something that works. So thank you.
You're welcome.
Thank you. All right, and we got our lovely Amanda back.
Okay. So we went through Diva and the changes it does to the inside of our body. Do you want to talk about Diva Tight?
Yes, let's talk a little bit about Diva Tight. So Diva Tight, as it would say in its name, it tightens the skin, but this is now the outside part of the genital area. And this, it's part of, again, pregnancies will definitely, we know that it can cause laxity and enlargement of the local tissue. Is just basically from all that wonderful thing that grows inside our uterus will cause that. So, it's very natural. It's part of that process. However, a lot of times it doesn't go back to where it was before. And especially if multiple pregnancies fairly soon after one another, this is even a bigger problem. So the same laser company who actually designed Diva actually designed part of the treatment where we can treat the outside part of the genital area to actually tighten the skin there as well. So sometimes we combine the two, and sometimes we just do the Diva on its own. Sometimes we do the Tight on its own. So it can be actually customized based on individual symptoms and complaints. And this is why it's so important to actually do a consultation so we can customize and design this to make it very personal and reassure everyone that this is something that we can safely do for them. But the tight part is important for certain individuals where there's a lot of tissue laxity outside of the genital area.
Okay. So I know when you decided to bring this technology onto our practice, you observed many other devices as well and determined that this was the best fit. Can you talk a little bit about, other than the specific technology, maybe why you chose this over some of the others? Because there are quite a few other competing technologies out there.
Yes, and so as I mentioned, this is an erbium diode combination, so 2 laser wavelength. Basically, similar to erbium is CO2 laser that, just like I mentioned, we use these technologies on the face. This can be used in the genital area too. Now, some companies decided to use the CO2 laser instead of the erbium vaginally. I can tell you that treatment, in fact, very painful. This is all the reviews that has been not only on social media but also on the medical literature. So it is significantly painful, and the recovery is also longer because it actually enters into the skin much deeper, and therefore it is hitting more nerves, and therefore it is actually more painful. The other technology that I want to mention, that radio frequency, that we also use on the surface of the skin for rejuvenation, and it works very well on the surface. However, it seemed to be that in the genital area, to heat up the tissue is very different, and it can cause, again, significant pain. Also, the exposure, the tissue exposure has to be much longer, and so the treatments are longer, and it somewhat becomes a little bit of on an awkward side, especially the way the technology were developed with those devices, where the handpiece that delivers the radio frequency has to move in and out of the genital area. So that is, to me, we have done a lot of research with that, but certainly I feel like that I want to do something that works very minimally, very minimal discomfort or none, so to say, and also somewhat quick. Since this is a sensitive area, you don't want someone to be exposed there for a long period of time. I can tell you that, because we are all women here, and but it's not something that it's very pleasant. So I mean, we have done a lot of research, just like with our other devices too, and I find this the most effective as well as most tolerable. If we look at, actually, interestingly, the rate of how much people actually, or women who actually had this treatment, how much they like it, 100% of them would recommend it to a friend. 94% would say that they actually, after one treatment, the expectations were met, which is really good, and very hard to find other laser devices, whether we use it in the genital area or even on the surface of the skin, where the satisfaction rate is so high.
I have to mention that I think one of my favorite quotes from one of our patients, who's a young mother of 3, she told me that she got on a trampoline for the first time and didn't have an accident after her procedures. So we laugh, but it's so common for us when you're going on a run after you've had children.
Yeah.
And it's, embarrassing, but like Dr. Szabo said, there's things that we can do to correct that.
Yeah.
So.
And I just feel that something that we can do and make such an impact is all of us feel very passionate about.
Great. Do you want to take some questions?
Yes,
from the
absolutely.
audience?
Let's do
Okay,
it.
let's take
Let's
a look here. Okay. I have an IUD. Am I still a candidate for Diva?
Yes, we can still do the treatment. That's not a problem.
Okay. And how long does it last?
So, this is, it's hard to know exactly how long, but, based on the research that we have available right now, we say that it at least a year. However, even after a year, we only basically recommend one, maintenance kind of treatment. And even if you don't do that, the results the results will still be there. Maybe not as good as right after the 3 treatment, but you will still have. So it's not that after 1 year it will be right back where you started, where we started the treatments. The best comparison I like to say is that we turn the time back, but the time, the clock is ticking, right? So it's the same thing on our face. Like, we do something, we do a treatment, we do a laser treatment, we turn, our face for, we turn the clock 10 years back, but we continue every day to age, which I don't like to say it, but, it does happen. So when we stimulate collagen, we will all of a sudden we boost up our collagen, we thicken the wall of the vaginal wall, and then over time that collagen starts to break down. So this is not a forever reversing, but it should be for a significant amount of time.
Great. I think we have some more questions here. Okay, there we go. I'm 42 years old. I have had 2 children. Am I too young to have this procedure?
Absolutely not. Absolutely not. We actually had other patients with your age, even younger. Again, I think a lot of times, genetics do play a huge role, when all these things start to kick in, when the symptoms will appear. And, I actually think that a lot of times women start to experience this in their mid-30s. In fact, our hormones, we know it change. At the beginning of the 30s, it start to kind of decline slowly, of course. We know also from other kind of studies that fertility after age 35 is really difficult to get pregnant, and that's why so many fertility institutions actually do IVFs because the hormone level is no longer there. So we know that in fact hormonal changes start early 30s, mid 30s is already symptoms appear. So doing it in the early 40s is absolutely not early. And you probably, after the 3 treatment, you may be in that category where you may not need every year maintenance. You may be just every other, every third year because you are young. And possibly your results will be much better because we are actually stimulating cells that are younger,
Okay. Let's see if we have any more. I apologize if we don't get to your questions because this is a social media platform. Some of them are being filtered. So we absolutely can do consultations in our office and delve a little bit deeper and certainly, like Dr. Szabo mentioned, cater this procedure to your needs and talk about those questions if we are not able to get to them.
Yeah, and if really a question arise that we didn't address today, but it's very personal, but you're not certain if you need the consultation or not, you can actually email to us too, and we are happy to get back to you, or if you would like a phone call before you set up your consultation, we'd be happy to do that.
And that email address is skincare@altavistaderm.com. You'll also find that email address on our website as well. And you can submit inquiries via our website, and our cosmetic patient coordinator will contact you personally. All right, let me check and see if we have anything else. I think everything else has probably been filtered. Unfortunately, let's see. Yeah. All right. Well, in honor of this great event, and Valentine's Day is coming up, we are running a promotion for $300 off of the package. We're doing it because, like Dr. Szabo said, we're really passionate about changing lives, and this does change our patients' lives. We've seen it day in and day out. We've had people who have only done 2 and they've moved out of state because they experienced such great changes just after 2. So we really love this procedure, and we hope that, if this is something that is concerning to you, that you reach out because we can definitely help.
Absolutely. Encourage everyone to, it's full, it's confidential, and something that, you see, we talk about it in our office, and we can help. So if you have questions and you don't want to bring it up here in this platform, we understand, and we are happy to help you. We're here for you.
Right.
And then we're going to cheers one
cheers
more
again.
for you.
You too, Adrienne.
Yes, absolutely.
Come on in.
All right. Oh. There we go.
All right. Well, thanks for joining us, everyone. You can give us a call tomorrow. Our office will be open. Feel free to email us. Continue to follow us on Instagram and Facebook. We've got a lot of fun stuff happening in 2021. We can't wait to see you. Cheers.